Y'all didn't bring him any cookies?
Well, I guess then we won't be using any anesthetics.
No pain medication.
That's okay, it was a joke. We don't have any pain medication.
Anyways.
Wouldn't worry too much about it now. Now, did I hear that someone here, you have a child here?
Yes.
Which one of these is yours?
Mine. That's Olive.
Dear.
Yeah.
Olive is actually
Well then I think you'll find that
Yes.
you probably have a headache from time to time with a little rapscallion like this.
Yes.
I have just the thing for you, madam.
Perfect.
My old friend here, he's called Hirudo Medicinalis, the medical European leech.
A leech. What do? They suck blood.
Absolutely.
Oh,
So, what are you going to do with this young lady? You're going to pop two in your mouth and let them dissolve slowly.
What? No.
You're going to put one on your forehead, you're going to put one behind your ear. It's going to feel like 1,000 little needles stabbing you at once. After that, it shouldn't be too much pain. They're going to suck your blood for about 20 minutes or so, and then they'll drop off naturally. You'll bleed for another 4 to 5 hours. After that, your headache should be gone. And just think, next time you have a headache, you'll remember the treatment and it'll go on its own.
Yeah.
Modern medicine, fantastic stuff, isn't that one?
I need him at work with me.
Isn't that fabulous? Now,
But you should be taping this and
my name,
showing
ladies and
them.
gentlemen, is Mr. Harper. I'm not Dr. Harper because I'm a surgeon. In England, doctors are doctor and surgeons are Mr.
Really?
We eschew the doctor part of our title. I am a mere member of the Royal College of Surgeons where I was educated. So, Mr. Harper.
Yes, sir, Mr. Harper.
No, no. Soldiers still call me doctor, but what can you do? They don't know.
Yeah, that's right.
But I'm here at the Alamo with the other 7 doctors looking after the men here and their health. They are affected by a number of complaints, mostly of their own doing. You see, being European, I bring some of the most advanced medical practices to the field. America and England had a little bit of a falling out in the 1770s. I can't exactly remember what for. Something to do with tea, I think. Now, as a result, a lot of Americans no longer go to English medical establishments to train, and as a result, have relied more on folk medicine. Whereas Europeans have advanced techniques like make sure you wash your hands before eating and boil your water. Technical stuff, I know, but we tell the soldiers of the Alamo to do this, and they do not. As a result, they come to me and they say, "Oh, doctor, I am terrible sick. I don't know what is wrong with me." I say, "You're an idiot. That's what's wrong with you. Don't listen to your doctor." Oh, well, it happens a lot. But why do we use leeches to take your blood? Do you know? Yes, young lady. Well, actually, because you are sick, to make you better, you see. Now, we work on the principle, and this is a very old principle, that your body has 4 fluids in it. These are called humors. These humors are blood, black bile, yellow bile, and phlegm. And they're very important. These humors are in a state of balance, equilibrium. And when they get out of equilibrium, when one is dominant, it makes you sick. Too much bile makes you sick. Too much blood, it makes you sick. This is very old medicine. This has been around since Roman times, and before that, Greek times. 500 BC, I should say. 500 BC. So, over 2,000 years this medicine has been used. As we know it today, we don't fix it. But clearly you are broken, otherwise you wouldn't be here. So, let's say that your fluid, your humors are out of sync, you'll get sick. Now, these are tied to the seasons as well. So, who here has had a little bit of phlegm in winter? Who's had a cold? I think quite a few people. The Texan winter, you people call winter. Yes, so you have, young lady. Now, that is because in winter, your phlegm levels naturally rise, and you get very phlegmy, and that will make you sick with a cold. Yes. So, we need to bring your humors back into balance. Now, the dominant humor, the most important one, is which one, do you think? Blood, absolutely. So that's why we use leeches. Now, there is a more direct way to get your blood back in balance, yes. My dish. You notice this will fit my hand quite nicely because it is a bleeding dish. But how do I bleed you? I hear you say through gritted teeth. Well, with one of these. This is a phlegm. It's a cutesy name, applies to horror. This is a series of blades for bleeding the back of the hand, for the arm, for the leg, and for the thigh, the deepest area. It will make an incision and you will bleed someone. Now, how you are bled depends upon the doctor you are seeing. So, some doctors will say bleed them for an amount of time. 15 minutes for you, young lady. Other doctors say bleed them for a mount. A pint for you, I think. And other doctors say bleed them until they pass out. Boom! Down they go. Right, we're done. Personally, I'm a bleed them for a certain amount kind of doctor, but that raises a secondary question. How much blood should I take? Well, that depends, you see. If you are looking at a strong, stout, tall gentleman like this in the red at the back here, he clearly has 12, 13 pints of blood in him. Whereas someone who is shorter and smaller, you, my dear, you're a smaller person, therefore you maybe have 3 or 4 pints of blood in you. A bigger vessel has more fluid than a smaller vessel.
More than you?
I'll give you an example. Who knows who George Washington is? He is the first president of the United States of America. Not the first president, there were 9 before him, I believe. But he is a very big man. Sir, how tall are you?
6'4".
6'4", perfect. George Washington is the same size as this gentleman here, 6'4", so he is a big, strong individual. Maybe why he defeated the British. So, don't like to talk about it. So, towards the end of his life, and there's a little hint there, he got sick with a throat infection. When modern medicine would not avail him of a cure, we bled him. Now, being of a tall stature, we know he has 12 to 13 pints of blood in him. So we bled him for 6 pints of blood. Some people are groaning, and that's because some doctors suggest that all people have around about 8. So if you take 3/4 of someone's blood, it may be detrimental to their health. Washington did not survive the procedure. Oh well, there's more where he came from. So, now, as I say, if you are sick with other humours out of sync, then we will need to purge you of them in other ways. Should point out here as well that the medicine is also known as heroic medicine. The idea being the treatment should shock the disease from your system, and it should be very dramatic and make you feel very heroic indeed. With that said, this is for purging your stomach. This is syrup of ipecac.
Oh, no.
Some of you might know this.
Oh, no.
Some of you might know that this is an emetic, which means it makes you throw up. And it will do so very violently for about 2 hours. And after that, you definitely feel very heroic. And it sounds very dramatic to anybody in earshot, I guarantee you that. Young lady, you don't look like you had the idea of that. Don't worry, I have an alternative. We can always purge you at the other end.
Oh, gee. Which end do you want?
Are Dr. Rush's patented bilious pills. Bit of a mouthful, I know, madam. The soldiers call them thunderclaps. These are not a laxative. They do not make it easier for you to go. They make it imperative that you go. Some would say mandatory. Now, very popular indeed. Do you know Lewis and Clark? Have you ever heard of them? They went on a little adventure up north, didn't they? They took 50 dozen of these with them. Took a lot. Mainly they're made out of callop, which is a very hot pepper, and mercury chloride. Now, mercury chloride is a chemical that stays in the environment a very long time, so much so that I imagine in decades to come, maybe even centuries, you can see exactly where Lewis and Clark went by where they went. That means where they pooped. Little giggle at the back. Very good. You still don't look happy, young lady. For you, and just for you only, I will give you a third option.
Oh, listen.
This is an antimony pill. It is made of a chemical called antimony. It's a lustrous silver metal. And with that, you will put it in your mouth and swallow it down. It's quite a big pill to swallow. And it will purge your intestinal tract of your toxins within your body, making you well. You will then pass the pill. You will retrieve the pill. You'll reuse the pill. Again and again throughout your life. And when you are old and grey and ready to shuffle off this mortal coil, you'll give it to your children. So they can use it. Here you are, son. This is your inheritance. 20 acres of land and this pill. Because I hate you. That's why they call it the everlasting pill. Great value for money. But aside from purging people of their ills, a lot of the time at the Alamo I'll be dealing with soldiers. And soldiers have a tendency to get wounded in combat. Sometimes they'll be wounded with things like this. That's the bayonet. That fixed on the end of a rifle, and you stab people. Now, what is the normal thing to do when someone runs at you with something sharp and pointy?
Run away.
You clearly had military training, madam. Very good.
Yes, I do.
You run away from them. As a result, only about 2% of injuries are with bayonets. Most injuries, by contrast, are with these. These are bullets, quite right. Musket balls. These are very large and travel quite fast, thus harder to run away from. For those who would like to know, this is a 69 caliber 480 grain bullet. That means it's big. So, when these strike you, they will change shape, they will flatten slightly. We call this deforming, which means if it enters you with a hole that size, it will leave you with a hole this size. If it leaves. Because they put so much energy into the body, what they may do instead is not have enough to get out again, and they will instead bounce inside you, like a pinball. One gentleman I operated on had been shot in the intestinal tract. During a duel, the bullet had pierced his intestines in 7 different places as it bounced around. Very unpleasant. It will go in your ankle and travel the full length of your leg before stopping. So, try not to get hit. Now, if you are hit in the chest or stomach, you will most likely die. If you are hit in the head, it's good night to the enemy. If you are hit in the arms or legs, good news. You will just most likely die. Probably of infection afterwards. But, now, madam, what is your name? Amanda. Amanda, I'm going to turn the sexual stereotypes of the age upon its head and say you are a soldier. And you have been shot. Sorry about that. So, when Amanda has been shot here, I will do my effort to remove the bullet from her body. In doing so, I will use the most advanced technical tools of the day and age. My finger. We'll have a good old root around inside Amanda, see if we can find this thing. What, sorry? What, ruined my leather gloves? Are you mad, woman? No. We'll have a good old root around. If I can find it, I will pull that out, take the bullet, drop it down, sew you back up, good to go. Now, if it is a little bit deeper than that, I may have trouble. So in that case, I will use something called a bullet probe.
Oh, you did a bullet probe.
That's the right face to pull, madam. Clearly you've had medical training. Now, so with this, we'll put a little ceramic tip on the end, and we will have a good old root around in there and see if we can find it. Amanda, please stop screaming. It's very distracting.
Right.
Now, there are 2 things that are hard in Amanda's body right now. One of them is the bullet, and the other one is her... Very good, her bones. We don't want to pull those out. That would cause undue suffering to the patient. Ha ha, little surgeon. Now, if I pull it, it is from my perspective. If you pull it out and there is silver streaked on the ceramic, that is the lead from the bullet. We know we're in the right place. So again, out comes the forceps. We reach in, we pull the bullet out, and sew Amanda up. If I cannot find the bullet, I will leave it there, because cutting you up will likely kill you through infection. So we will leave it. So you may be walking around with something that size in your everyday life, and yes, lead poisoning may potentially be a problem. So,
She'll be fine.
we're going to assume that Amanda has actually been shot in the leg. Which is your favorite leg, my dear?
The right one.
We'll take off the right one then. So, she's been shot in the leg. Now, the closer to the trunk, the main part of the body the shot is, so to the hips and the shoulders, the less likely you have a surviving amputation. So we're going to assume that you've been shot just below your knee. Now, you're wearing kind of capri pants, that's good. I'd hate to wear in a good pair of trousers. So, what we're going to do is take Amanda and we're going to lay her on a table. Now, she looks like a bit of a fighter, so I'm going to have 4 or 5, maybe 6 or 7 people hold her down. One of them is going to be at the end, and they are going to hold the leg that we are going to amputate.
That'd be Amy.
Now, I'm going to give a little caveat here. If you are stood with your legs locked in position, please take 1 foot back and stand with us slightly. If you move after locking your legs, there is a good chance you may pass out when you try to move again. It does happen here. I don't want to see you hit the ground. Also, if you want to walk away at any point, feel free to do so. I will simply assume you despise me because I am English. So, with that said, I am going to show you how to use a capital knife and a bone saw. If you don't want to hear that, feel free to walk away. So, give you 5, 4, 3, 2, and 1. Amanda, you can't go anywhere. So, very good. Now, the first thing to do is to take the capital knife. It is razor sharp along one side. Put this around the limb in question, and with the fast motion, something called the turn de matre, the turn of the master, whip that round in a circle. You are cutting through the skin and some of the tissue. Now with the skin, slightly grim, you're going to pull the skin back like a sleeve. You are then going to take the knife again, move slightly further along, and cut a second time as deep as possible. With the Caitlin knife, you are going to then cut through the fine tissue, tendons, ligaments, and also the periosteum, the membrane around the bone. You are doing this as fast as possible because poor Amanda there has no painkiller. There is nothing for the pain. We cannot give her whiskey, despite what people might think, because that is a blood thinner, and you will bleed to death on the table, and that's an inconvenience I have to clean up afterwards. So, none of that. However, for the screaming, you can have a wooden dowel to bite on, maybe a strap of leather, or the old soldier's adage, you can bite the bullet. Should make a saying about that, shouldn't we? So, cut down to the bone, you're going to pull the muscle away as much as you can, take out the bone saw, and you're going to start cutting. Now, did you know, Amanda, that some of the fastest surgeons can do this in just about a minute? I am not a fast surgeon, Amanda. I'm sorry. Did you see the game last night? But anyways, here we go. Soaring, and oh dear. Not what you want to hear. We got through the leg, but the person holding the limb did not support it properly and it snapped at the base, producing a very jagged bone. But we have something for it. This is a bone chisel. Does exactly what it says on the tip. We will take a hammer or mallet and we will chisel away the end of the bone. We will then take the rough end and use that to rub down the bone as much as we can. Hopefully Amanda at this point has passed out. If she has, however, I may make efforts to revive her because it is considered safer to have you conscious than unconscious. So, with that done, for me anyway, the hard part is out. My arm was starting to get tired. That's incredibly inconvenient. So, we will take one of these tools. This is called a teneculum. Your arteries are not like an elastic band. When not under tension, they will retract back into the stump. We will reach in and hook those and pull them back out. We will then either do one of two things. If I'm in the field and I don't have any other efforts, I will take a cauterizing iron and touch this to the blood vessels, sealing them shut. However, that causes a great deal of trauma and damage to the tissues, and also it may cause a man to die of shock. Unsurprisingly. If I am able to, I will use something like silk to create a loop and ligature up the arteries themselves, a much safer option. Once that is done, we will take the skin that was pulled back and we will pull it back forward again over the end of the stump, which is now longer than, creating a nice end to your severed limb. We will then use a surgeon's needle with thread to sew that back up as best we can with sutures. And finally, these are being used, but that should be okay, shouldn't it? That'll be good. We will make something called a Maltese cross, put that over the end of the stump and wrap it up nice and tight. Now at this point, Amanda, I will give you something for pain. So you're either going to get whiskey, or more likely, you'll get a little dose of the old opium. Now, not straight opium. We will give you that mix, about 10% opium to whiskey or alcohol, something called laudanum. Now, laudanum is from the Latin laudare, meaning to praise, because this stuff is great. Oh, so, I like to take a little bit myself from time to time. Now, one for you, one for me. We're going to give you that. It's very bitter, so we're going to mix that with sugar or maybe cinnamon, something to take the edge off it. In no time at all, you'll be chasing the dragon quite happily, my dear. Very happy. Morphine is available. It was available in the 1820s in Germany, but it's expensive. It takes about 25 minutes or so to take effect, and also it's only in pill form. I imagine it'll be another 20 years or so before they invent some sort of hypodermic way to administer this. I imagine the first thing the man will do who does that is accidentally murder his wife with it. But we've got to have a hobby, right? So that's it. With that done, you now have a pretty good chance of survival, my dear. However, biting down as hard as you did on that bullet, you have cracked your teeth.
Oh no.
But fear not. Wait, nope, that's wrong. Fear so, for I am also your dentist. For that broken tooth, what we are going to do is use this. This is a tooth key. We are going to put that over the end of your tooth and we are going to turn. And eventually, pop, out comes that tooth. But of course, you know the roots in your teeth are about this long. They're very big and that may break off during the extraction. If we leave that in there, you will get an infection and that will kill you. So we'll use something called a goat's foot elevator. This we'll use to reach inside the gum and pull out the broken shards of enamel and end of the root. I often wonder why there's fingerprints in the chair in my office. But of course, young lady, you know the best way to avoid going to the dentist, don't you? What do you do? Do you want to help her? What do you do to avoid going to the dentist? Brush your teeth. You came back there. That's a toothbrush. Not everything I have is terrifying. Just most of it. This is a toothbrush. It's made out of bone and hugs hair bristle. That's pig hair, okay? Now, young lady, how often should you brush your teeth? She says twice a day. Incorrect. Once a month will do just fine. How does she get any work done when she's brushing her teeth all the time? I don't understand. Okay, you failed that, but we'll give you a chance to redeem yourself, young lady. What's your name, by the way? Natalie, was that? Excellent, Natalie. Now, Natalie, when you brush your teeth, you would use the toothbrush, water, and what third substance that goes on the toothbrush? Yes. Incorrect, you teach her nothing. You would use ash from your fireplace. Or maybe, if you're going on a particularly hot day that night, you might use a little bit of human urine in there as well. Give you extra spot. Now, these are expensive. This is 36 cents a toothbrush. An acre of land is only 12.5 cents. So maybe you might just have one in the family. Dad gets to use it first, then Mom, then all 7 children from the oldest to the youngest. So make sure you don't have any disgusting older brothers or hot dates that night. You didn't know what that pee tastes like.
I don't have any.
That's good. Now, if you don't go to the dentist, you will most likely get some sort of abscess or swelling. And at that point, we're going to need to drain it of pus. We will use something like this. This is called a trocar. Trocar is from the French trois quarts, meaning 3 quarts. God help the man with 3 quarts in his food. Very simple application indeed. You take the trocar and into the person it goes, pull out the end, and you use that to drain the fluids. Lovely stuff. Now, the other type of swelling I deal with on a regular basis. Amanda, it's you again. I'm sorry. You see, maybe with the pain of your wounded leg, you're out drinking a little heavier than you normally do, and you're not as steady on your feet, and you fall and you hit your head. You have swelling on the brain, and that will kill you. So we better operate. Now, we're going to take out something like, there we go, that's good. Something like this. This is a scalpel, also known as a lancet. It's been in the same form for almost 2,000 years. Roman scalpel looks exactly the same. We're going to cut down the scalp, peeling it back to reveal the damaged area of bone. We are then going to take out this. This is a trepanning saw. This will be placed against the side of the skull and we will turn, cutting a hole in the skull. Pop it out with the bone and plug, thereby leaving the pressure to escape, saving your life. But we are not barbarians. We can't have you walk around with a hole in your head, can we? So we will take a Spanish silver dollar, hammer that flat, put 4 holes in it, put that over the hole in your skull and screw it into place. Put the skin back over and you're good to go. And look, you may have a little bit of a scar, but you're alive, and now you're worth at least $1 more than you were before. So that's nice to know. And Amanda, it's got a very good success rate. You're looking about an 80% chance of living. Reason being is this is an old surgery. This is the oldest surgery known to man. It's been performed for over 9,000 years. And we know from the skeletons from the Neolithic period, they have trepanning holes in their heads and they have bone healing around the edges, and your bones only heal if you're alive to do so. So you got a good chance. Now, if you do want to make an appointment for either the dentist or surgery, come see me and be free to make it. Thanks for visiting the Alamo today. My name is Mr. Hart. You're too kind.